Hey everyone, I'm Dr. Sully, and I'm a dentist in Nashville, Tennessee. I've been practicing dentist since 2015 when I graduated. I get to practice with two other dentists, and very quickly in our practice, we started using a lot of different technology to really push our practice to better serve our patients, and we've been a very forward-thinking practice. So, as new technologies arisen, whether that's CAD CAM, cone beam CT, and now 3D printing, we've been pretty quick to act on it. And so we started using 3D printing back in 2017. We had a Formlabs printer, the Form 2. That was the first printer we had. And then pretty quickly, we got a couple of more printers. We got the Moonray, and now we have the Sprint Ray Pro as well. So in our practice, we do a lot of same day restorations and milling, and now we do a lot of printing as well. Outside of practicing dentistry, I get the privilege of getting to kind of lecture around the country. We teach a number of different things from dental sleep medicine to we have a dental implant continuum now to 3D printing, oral conscious sedation, and some CAD CAM stuff as well. So we kind of have a full slate of curriculum with a number of different awesome educators in Raleigh that we teach with. Other only kind of cool fact about me too, in 2016, I started a podcast called the Millennial Dentist Podcast. So check that out if you like listening to podcasts. And really, that podcast is focusing on young dentists kind of making their way in their career and how we can kind of work smarter, not harder, with technology and climb the ladder to being successful. When I first got into 3D printing, obviously doing digital dentures or 3D printed dentures was something I wanted to do. One of the first steps that I've kind of realized in 3D printing in general is that design is really important. That the printers print really well, and we have a lot of resins available on the market, but you're only as good as your design. And when I was looking at different options on the market for getting a 3D printed denture and getting that denture design, I really struggled to find something that looked good, that had a lot of different variability in how I could print it, either as one piece or in different pieces. And so that's when I found Dentca Design. And one of my favorite features of Dentca Design is that I have the option to do it myself or have it designed by Dentca. So that way I have a flexibility in kind of the situation of getting that design. And then once I've got it, now I'm able to print using really nice resins to deliver dentures in our practice. In our practice specifically, we use our 3D printed dentures for immediates, and now we're actually using them for converting teeth same day for all on fours and fixed hybrids, so that the interim prosthetic that these patients are wearing is actually a 3D printed denture using the Dentca resin, utilizing Dentca Design. Yeah, so I transitioned to the Dentca platform really because I was looking for a DIY design approach for 3D printed dentures. I had some labs that would send me a denture design using in-lab software at the time because I was a CEREC user, but I didn't love the design necessarily, and I wanted to have the ability to do it myself. So what prompted me to really start using Dentca Design was the ability for me to do it myself, which also then led to me knowing that, hey, there's that opportunity for it to be designed by y'all as well. But the first thing that got me there was being able to design this in my office at my own convenience, with a software that I didn't have to pay a lot of money for, such as exocad. I was able to basically get the design and do this and then just pay the export fee for the design that I created.
Awesome.
Thing that attracted me to Dentca Design was, one, I love the opportunity for the different tooth libraries available within the system. So you have a lot of flexibility in not only the tooth shape that you're using, but also where you're putting the teeth. So in the design software, I can move teeth individually. I can move them as a quadrant or even as an arch. So I'm really able to set teeth virtually like I would if I was using an analog approach. So that was kind of how I learned, was obviously setting teeth back in dental school. And I now have that same flexibility digitally. The thing that I really like compared to other platforms is that ability when I feel like, hey, this is more than I want to bite off, I can send it and have it designed without doing it myself. So to me, it kind of gives this good opportunity to, if I feel, hey, I'm good with this case, I can design it myself. I have the DIY approach. If not, I can then continue to send it to Dentca, where I can get the design back, in a 48-hour turnaround time to then print myself. the where I really found that 3D printing dentures was a great opportunity was we were actually at I was actually at a course in Raleigh. We were teaching 3D printing back in December, and we had a patient coming in on Monday morning that got added to the schedule really late. So the patient came in on Wednesday, and they wanted to do a fixed hybrid denture on Monday. They were ready to pay, ready to go, and time was of the essence because they were trying to get this done before the holiday season. And so I called a number of my different labs and was like, hey, can you get me an immediate denture by Monday? Basically I was asking them, can you do a denture tomorrow and then overnight at me? And all my labs are basically like, this time of year, there's no way we can do it. I'm sorry, you're out of luck. So that was actually when I messaged y'all and said, hey, I got this case coming up on Monday. Is there any way I can get a quick turnaround time on a design? So sure enough, Dentca was able to do that within 24 hours. I had the design done, and I was actually able to 3D print it at our course and have it ready to go for the Monday morning surgery, which went great. So we actually converted that denture, and she left with a 3D printed converted denture and really made that surgery happen. Whereas if not, that patient wouldn't have probably had teeth for the holidays, and we wouldn't have been able to close the case like we were.